Hi everybody in YouTube land, this is Tony. Week 14 up, no, no, month 14 update. Um, I am 14 months out and about 1 week on top of that. I weigh 194 as of yesterday morning. That means I've lost 109 pounds, I think. Uh, so 194, and they take off about 10 pounds of excess skin, which is average for a 100-pound loss, so about 184, 85 true body weight, and that means I have another 15 pounds or so to go. So yay, me. Having a good time, enjoying the warm weather. You know, it's really nice without my fat suit on. I don't mind the heat. How do you guys feel about it? I feel much better in the heat. I actually enjoy it. Feels good. Sometimes I get cold and I want, to feel warm. So I'm enjoying it. I went to that event in Las Vegas. It was really, really hot in Las Vegas, but it didn't make me miserable. I mean, in my prior self, May 18th of 2009, my 303-pound body, had I been in Vegas in that weather, oh my God, I wouldn't have made it. We had to walk a long ways from our little travel lodge over to the Aria, and I would have never made it. But I didn't feel bad at all. The heat does not bother me. So that's cool. That's a non-scale victory, right? Been riding my bike. Rosemary's been inspiring me lately. Rosemary, I can't tell you how proud I am. I'm so proud of you. I mean, I always loved you, and I'm always proud of you, but at 6 years out, for you to find this new partner, 31 Christine, and for you guys to motivate each other to exercise and do all, I mean, these girls aren't, they're like swimming, doing elliptical, treadmills. Rosemary got a tricycle, so she's riding her bike for miles a day, and all of this stuff is new, and she's losing inches, and I'm so proud of her, because I know how much she wants this, and I want it for you, Rosemary, because I want you to feel happy and confident like you should. And anyway, but because they're doing it, I'm like, well, heck, no excuses. Get on your bike. In fact, after I do this video, a couple little work things, I'm getting back on my bike too, right? I don't know why I talk with a southern accent when it comes to exercise. Oh, I think I have a separate, maybe a split personality in there. I also have an English accent that comes out occasionally. I met some interesting, cool people at the event. We went to this party one night, and it was all bariatric surgeons, and I was standing at this table with this older gentleman, and these three women whom I thought all looked very young, but they were telling me they were my age, and I was like, why did I smoke all those years and make these wrinkles? Young people don't smoke, it gives you wrinkles. Anyway, and the doctor, well, they were all doctors. I'm like, I'm not a doctor, and they're like, thank God, because they get sick of each other, I guess. But the one doctor I was talking to, he was retired, and he had an English accent. It was all I could do not to start talking like that. He actually has been doing the surgery since the 60s. He was a pioneer, although he said when he started they called him a butcher. Yeah. But anyway, he just retired a couple of years ago, and his name is Dr. Heap, and he was totally interesting. And then there were these younger gals, or actually my age or a little bit younger, all bariatric surgeons standing with me, and they were like fascinated to talk to me, like, oh, you've had the surgery? And they had all these questions like, what do you think? How does it feel? And I thought that was kind of curious. I'm like, don't they talk to bariatric patients all day long? But maybe because it was in a social setting, they felt they could ask me questions that they really couldn't ask in the office, or it would sound funny, But anyway, and the funniest thing was, at this party, it's like a huge bar with 3 stories and like 4 actual bars within the bar, and then they had the whole thing catered. It was very schwanky, and I didn't eat because I'd eaten before I went to the event, because I didn't know what they were having, and I wanted to make sure, I had my healthy food, right? And here's all these bariatric surgeons going, aren't you going to eat? Why don't you go get something to eat? Aren't you hungry? I'm like, I'm not hungry. I've had my hunger removed. No, it was just the weirdest thing to have all these bariatric surgeons tell me to eat the whole night. But anyway, and yes, I did drink. I was trying to get a vodka gimlet, You guys know what that is? They're good. It's vodka and lime juice, basically, and I like it because there's no soda involved or anything. And I don't, well, usually I drink white wine, but you know, if I'm going to have a mixed drink. But I couldn't get that at that party, so I got instead Diet Coke and rum, which, you know how the Coke that comes out of those things isn't as fizzy or bubbly as the Coke from a can, so it really wasn't too bad. So I had that. And anyway, that party was fun. It was sort of the big social event, and then I went home the next morning. Other than that, I'm going to talk about the details of it at the WLSFA YouTube channel. Okay, so I'm doing good. I have, you know, I want to talk about one thing I learned while I was there, because this is good for pre-op people, and maybe some of you post-op people. I don't know if this is the case with me, but if I don't take my Prilosec, I am miserable. Okay, my stomach just feels, it's not like heartburn, it's not like a stomach ache, it's not nausea, it's just a uncomfortable, almost feels like my stomach's bruised, if that makes sense. It's just uncomfortable. And if I take my Prilosec, fine. I have no issues. I feel like a normal human being. Well, when I was at the conference, there was this booth there, and they were talking about a test that pre-op people should take. It's for E Pylori. It's a bacteria that lives in about 35% of all people's stomachs. And E Pylori, although rare, can cause stomach cancer. And so it's something that if you have, you should have it, you can have it cleared up with 2 weeks of antibiotics. So anyway, I'd never heard of this thing, and I'm pretty sure I didn't have a test for E. pylori prior to my surgery. And I'm going to go check my official records. I was one of those self-pay people where I said, "Hey doc, here's 20,000 bucks. What can you do for me?" And she's like, "Let's pick a date." You know, boom, boom. I mean, I had I did have some blood tests, and I had, you know, the EKG and all that stuff, but it was pretty rapid fire. Okay. So I'm not sure I had a test for that, but what they were saying to me was Prilosec masks the symptoms of E. pylori. Sound familiar to any of you people out there? Does to me. And unfortunately, once you've had a gastric bypass, there's no easy way to get rid of E. pylori. And now we're learning that taking Prilosec long term may not be so good for our bones, which is kind of a double whammy because we already have a problem with calcium. So anyway, I'm not real happy about this, but I'm going to go through all my old tests and check with my doctors if I had E. pylori test. Had I had it, I would have had to have taken 2 weeks of antibiotics. So none of that happened, so I just don't know. But for you new people thinking about getting surgery, make sure you're tested for E. pylori. There's a breathalyzer test and a blood test. They recommend the breathalyzer type you blow into a little thing. And if you have it, it's no big deal. You take the antibiotics. After that, you have your surgery. But anyway, for other people like me, I think, who have it now, to cure it now is kind of a bigger deal. So as I learn the details on that, I'll let y'all know. But again, just some word to the wise, right? Hope you all have a beautiful week. It's sunny and warm here. I'm going to go ride my bike. Bye, everybody.